everybody. Ahem, down here. Hi, kids. I'm Buddy. Can you say, hey, buddy? Aw, come on. You can do better than that. One more time. Thanks. That's much better. Today, we're going to go into this building. It's the children's clinic. And we're going to talk to doctors and dentists and all the people that help them. And you can learn about their jobs. Let's go.
Hi, welcome to the Children's Clinic. My name is Sana and I'm the clinic director here. At the Children's Clinic, we offer medical and dental services. Today, we're going to take a look at our dental team and what they do. We're so glad you're here.
Meet some great people from our dental team.
Hi, my name is Dr. Natalie Lane, and I'm a general dentist here at the Children's Clinic, and I'm also the oral health director.
My name is Dr. Chad Silver. I'm a pediatric dentist here.
A dentist makes sure that your mouth and your teeth are healthy because it's important that your mouth and teeth are healthy so that your whole body is healthy. And we also make sure that you know how to brush and floss properly to prevent dental problems, and we educate you on diet and other things to make sure you're not getting cavities.
Dr. Chad, why did you become a pediatric dentist?
So I actually chose pediatrics before I chose dentistry. My philosophy has always been that hanging out with kids is more fun than hanging out with adults. Even as an adult, I like sitting at the kids' table. I'd prefer to talk about sports, movies, toys than I would boring things that adults talk about. So for me, it was a no-brainer going to work with kids. Dentistry came along the second time because it's fun to interact. We get to see patients every 6 months. I get to watch kids grow from birth until college, which is very exciting for me.
Dr. Natalie, why did you become a dentist?
What made me decide to become a dentist is that when I was little, my grandmother's dog ate her denture, or her false teeth. And at the time, I thought it was so hilarious, but I just started to question, why doesn't my grandma have teeth? What happened to her? How did she end up with those dentures? So then in school, I made sure I concentrated on science and healthcare to prepare me to become a dentist, because I knew after that I needed to know how I could help people.
What's the best part about working at the children's clinic?
The best part about working at the children's clinic is hanging out with the patients and the families. Patients and families here are so appreciative of the work we do and so trusting in the work that we do that we're really allowed to collaborate with the family, make them involved in all the treatment that we're doing. And we really like to educate as well as treat.
I concentrate on health education and promotion because as dentists, we make sure that you're brushing your teeth properly, you're flossing properly, and that you're educated on some of the things that could happen to your teeth, like cavities and gingivitis and other diseases.
What's a typical day like?
Typical day here, I walk in, say hello to everyone, just like my mom taught me. I get all my things set up. I get my special glasses set up. They're called loupes, and I prepare for the day. I usually check in with my assistant about 10 minutes before each appointment to notify them what we'll be doing, things I'll need, a little bit of information about the patient's history, the family history, the medical history.
It sounds like you're very busy.
Very fun, rapid flow for pediatric dentists. We work with our patient that we're treating, and we also see other patients who are here for their checkups.
So a typical day for me when I wake up is I make sure I have my cup of coffee, and then when I get to work, I sign into the computer, I look at my schedule, I answer any emails I need to, and then I start saying hi to everybody in the clinic and making sure we're all ready for the day. We may have a little meeting beforehand to make sure everyone's on the same page, and then we begin setting up for the day. We'll see our first patient, and then it goes from there. We may see 4 operative patients in the morning, and then alongside that, I do exams with our hygienist. So she'll clean the patient's teeth and then I'll go do the exam on them. When you go to your dental appointment, your dentist may take dental x-rays on you. We use dental x-rays to check for what we can't see with our eyes in your mouth. We see your bones in between your teeth, under your gums, and that can show us cavities or some other problem that we can't see with our eyes. So it's really important to have those x-rays at least once a year to make sure everything's okay.
Should I consider becoming a dentist?
I think dentistry is the perfect field for somebody who likes being active. There's really no quiet days. There's always something to do. You work with your hands, you get to meet people, you get to interact with people, you get to talk to people. What's more fun than that?
It's always fun when I get to talk to our patients, and at their exam appointments, I usually ask them, what do they want to be when they grow up? And I get some interesting answers, but it's always a happy moment when someone says they want to be a dentist.
Pediatric dentists go to 4 years of college, 4 years of dental school, and then specialize for an extra 2 years in residency, seeing only kids.
If someone's interested in becoming a dentist, I would make sure that you love certain things like science. You should love school. You should love working with your hands. We do a lot of artistic things as dentists, and we also do a lot of surgery type things with our hands. So you need to be good at that, paying attention to detail. You have to be able to think about a lot of things at once so that you can keep your patients safe and make sure you're doing the right thing.
Meet Marisol and Lisbeth.
So a dental hygienist is a licensed professional that works alongside with a dentist to help provide good oral health hygiene to patients. And my goal as a hygienist is to prevent and treat any diseases that can harm the teeth and the gums.
Why did you decide to become a dental hygienist?
Well, I was a dental assistant for many years, and I decided that it was time to grow a little bit more, and I had a great experience working here with the previous hygienist that it inspired me to continue my education. And I still wanted to have that one-on-one with my patients, to still teach them what is the best way to clean their teeth, what are the best chemical compounds to use, like toothpaste, mouthwash, best flossers to aid each individual.
Marisol, why do you like working with children?
What a great question. Well, I love working with children because it is a surprise every day one is in my chair. There is no same questions, no same answers to either one. I've seen many of my patients grow up from being in an elementary school to now graduating high school and going off to college and deciding what they want to do with their own lives. And it's an eventful day every day. And I also get a big kick out of kids because I'll ask a simple question, so how many times do you brush a day? And I'll get an answer, oh, I brush 100 times a day. And I can definitely tell they are not.
Yeah, right.
Well, there's a couple processes to become a hygienist. First, you have to go to community college or college of your choosing and do 2 years of prerequisites, which is like English, a bunch of sciences, math. And then after that, you apply to another college for the dental hygiene program, and that is another 2 years. I would definitely consider and tell my patients or anybody, any of the kids that come, definitely pursue a career in dental and especially in dental hygiene. You don't know the difference you make in other people's lives and in kids' lives. Many times kids come into the chair not knowing what they're doing or thinking they're doing a good job, but once you start talking to them, showing them with that mirror, showing them where that toothbrush goes, you'll see like an enlightenment in their eyes, like, oh, I see what I'm doing now. I'm gonna try this the next time.
Lisbeth, how did you become interested in becoming a dental assistant?
So I grew up with a lot of dental anxiety. Even though I had really good dental experiences, I was always nervous in the chair when going to my dental visits. At one dental visit, I said, what if I start doing something in dental? And I wanted to do something as close as to being a dentist. Not exactly up there, but I like to be a helping hand.
What does a dental assistant do?
What a dental assistant does, we make sure everything is super clean before and after patient care. So we make sure all the rooms are stocked up. We have all the instruments out for the dentist depending on the procedures that we will help out with. We make sure all instruments are sterile and everything is clean at all times. We do help out the doctors bring patients back. We interact with them while the dentists are doing dental exams and are there as a helping hand at all times. The children's clinic needed a dental assistant. I saw the opportunity and was recommended, so I took it and I've been here ever since. Every office is different. Some require training and others actually offer training in their office, and I was actually trained here.
What's the favorite part of your job?
Great question. My favorite thing of being here is being able to be that helping hand to the dentist to keep the actual patient calm. I like to ask them how their day was at school, if they came from home, how their day has been, and just we're able to build that one-on-one relationship, and it kind of just helps distract them from what's actually being done. We get to learn a lot about each other. They learn about me and I learn about them, and we're all happy.
We hope you had fun learning about all the different jobs in children's healthcare. We hope to see you soon. Come visit us.
Bye, kids. Thanks for watching. I hope you got some good ideas about jobs in dentistry.